Well, good morning. As Greg said and Henry said, I'm Alex Murphy. I'm the new Associate Director of Social Science Research, and I've been in this role since June. It might be useful as way of background. I'm a sociologist, and most of my work has been on poverty and inequality in communities, and really using qualitative methods, hanging out with people, interviewing them to understand their everyday lives. So I'm really excited to bring these perspectives and to this role, and to work with you all to think about how we can use both the social sciences and technology to solve some of the problems of future transportation. So what I want to do with you today is share some of the stuff that's going on in M-City on the social science side. And to get into this discussion, what I want to do is start with a pretty simple premise. And that is that even though a lot of us are doing different things, some people are working on robotics, some people are working in different, some people are in industry, well, many of you are in industry, but in different parts. I think at the end of the day, what we are all here to do is that we are in the business of making sure that people can get to the places that they want to go, right? That's pretty simple. But yet this raises a number of questions for all of us. So one is, how well do we know if we are achieving this objective, either now or in the future? And that is, how do we measure how well our mobility initiatives are doing, how well we're doing in getting people to the places that they want to go? And related, how are we measuring the benefits to individuals in the communities where they live, in the communities where we work, to know if we are effectively getting people to the places that they want to go, right? This is sort of the ROI question. What kinds of return on investments do we get when we achieve our goal? And conversely, we might think about what the costs are of not achieving this objective, right? For individuals, for communities, for our own businesses, and for society writ large. And these are the kinds of questions that are really critically important, not only for our own understanding of how effective our respective mobility initiatives are, but also for helping people in the communities where we work understand the added value of our work, right? This is sort of the why question. Why are we doing this? Why would they invite us to deploy some of our initiatives into their communities? And to kind of help them understand this, we have to answer this question. So how should we go about answering that question? Where do we start? This is the kind of question that we've been asking about at M-City. And so what I want to do for the rest of our time together is two things. I want to share one approach with you on how we answer this. And I want to share with you some of the work we've been doing with different partners and communities to help them roll out this particular approach. And so to start that, I want to just ask you to reflect on a few questions. And these three questions, you have three response options. You can respond often, sometimes never. So maybe I'll just ask people to raise their hands. So in the past 30 days, how often would you say that you had to arrive someplace early and wait because of the schedule of the bus, train, or person giving you a ride? How many of you would say often? Sometimes? Never? Okay, so majority says never. In the past 30 days, how would you answer this question? How often were you not able to leave the house when you wanted to because of a problem with transportation? How many would say often? Sometimes? Never? Most of us. And in the past 30 days, how often did you worry about inconveniencing your friends, your family, or your neighbors because you needed help with transportation? How many would say often? Sometimes? Never. Okay, so based on extensive qualitative research into the lives of low-income families in urban, suburban, and rural places in the United States, my research team and I have come to learn that these are just some of the symptoms of what we call transportation insecurity. And this is a condition which we define as a condition in which one is unable to regularly get to the places that they need to go in a safe or timely manner due to a lack of resources needed for transportation. And when we think about resources for transportation, we define this broadly. It could be money for a ride or for gas. It can be not having friends who have cars, or it can be not having the physical health to walk. And this is a condition that can have dire consequences. It can make it difficult for people to obtain and keep work, access social services, move to safer neighborhoods, take their children to school, visit the doctor, buy groceries, visit family and friends, and even as we're thinking about November, vote. And while these experiences are things that people who are transportation insecure negotiate constantly, they and the concept of transportation itself has really been overlooked and understudied. And one of the things we hypothesize is that the reason for this is that researchers, planners, and transportation officials have really lacked adequate measurement tools to capture this phenomenon. And so in its absence, a lot of the tools and measurements that we use are proxy measures to try to tap into people's ability to get around. So for example, people use measures like mode of transportation. So a lot of people will study, do people have cars? Do they use public transit? We might think about travel behavior, right? What are people's commute times? We use activity-based models. Some people use neighborhood accessibility models, especially urban planners, where we think about how our communities, our neighborhoods, our census tracts, how accessible they are, how close people are to public transit, how walkable people are, how approximate they are to destinations. And then some people use one or more of the 5 A's of access. So affordability, availability, accessibility, accommodation, and acceptability. And while all of these measures may have some correlation with transportation insecurity, they don't actually accurately identify people who are transportation insecure. So for example, car ownership measures miss the fact that there are many people who have cars but can't use them, right? Because they can't pay for repairs. They may not be able to pay for gas at the time that they need the car. There's measurements of neighborhood accessibility miss the fact that people who live in neighborhoods that are deemed accessible may not be able to get around, right? So we've come to know many people who may not feel safe waiting at the bus stop, even though they live very close to it. And so the point is there's a lot of individual variation in neighborhoods that seem otherwise pretty accessible. When we focus on travel behavior, using measures like commute times, these kinds of measures aren't capturing trips not taken, right? Or they're not capturing people who are very transportation insecure. And one way we can think about it is they're not capturing the unmet demand, people who need rides but don't get them. None of these measures capture key ways that we know that low-income people tend to get around, which is social networks, right? Using your friends and your family and your neighbors to get to work and other places you need to go. And then finally, one of the issues in this field is that researchers and policymakers really use different measures inconsistently. It's really hard to make comparisons and draw general conclusions about populations and outcomes. Okay, so why might this matter? So lacking a valid measure of transportation insecurity, we really have a hard time. We can't understand the landscape or the extent of transportation insecurity in our cities, our regions, our states, and nor can we evaluate our interventions, our technologies, and our investments and see how well they're effectively moving people from transportation insecurity to transportation security. And more specifically, without a valid measure, we can't answer the following kinds of questions, each of which is really necessary to better understand how well we're achieving our objective of getting people to the places that they want to go. So it's hard to answer the question of how many people and who is experiencing this condition, how is transportation insecurity changing over time, what causes transportation insecurity, and what might its consequences be for individual, financial, social, and physical well-being, and what policies and technologies can effectively ameliorate this condition, and what are the effects of moving people from insecurity to security on things like employment, education, and health. So to address this, for the last 10 years, a team of researchers and I have been working to develop what we call the Transportation Security Index, which is the first validated individual measure of its kind that's explicitly designed to measure transportation insecurity as it's directly experienced by people, regardless of where they live or the mode of transit that they use. And so using this index and original survey data, we've begun to answer some of the questions that I laid out in the previous slide. So for example, in 2022, we published the first prevalence estimates of transportation insecurity in the US. And what we found was that 1 in 4 adults in the US are experiencing this condition. We found that 53%, so over half of people who live below the federal poverty line, are experiencing transportation insecurity. And we find that those who are Black and Hispanic were much more likely to experience insecurity than individuals than were white adults. When we look at geography or insecurity by geography, we found some really interesting results. We basically found that transportation insecurity is most prevalent in urban areas, then suburban, and lastly rural, which was surprising to us and that's something we wanted to get into deeper. And more recently, what we've done to sort of put those numbers in context, we finished a paper that compared those rates to other forms of material hardship, right? So housing insecurity, difficulty paying for your bills, unmet medical needs, food insecurity. And what we found was that transportation insecurity is the most prevalent form of material hardships that is experienced by Americans, including food insecurity, which I think if you are a person in the social sciences, really, that's a material hardship that receives a lot greater attention, especially from policymakers. In the same analysis, we also found that transportation insecurity is as strongly associated with poor self-rated health and depressive symptoms, and both food insecurity and unmet medical needs. So in short, transportation insecurity not only ranks as one of the top material hardships people are experiencing, but it also ranks as one of the top hardships that matters for very consequential outcomes like health. So that is an overview of why this index was warranted from our perspective, and sort of a preview of the kinds of information you can generate with it. But for the rest of our time together, I want to do two things. I want to discuss with you how we developed this index, because I think really understanding sort of the nuts and bolts behind it will help you understand what it can do and what it can't do. And then I want to just talk with you about the ways that we've been working with communities and partners to implement the index, and in ways that help us better understand whether our initiatives are working to move people to transportation security. So if you are going to create a measure of transportation insecurity, how would you go about doing it? This is sort of the question that we were faced with. And for us, what we did is we determined that given all the things that go into getting around, right? From having a workable car, to money for repairs, to having a valid license, to having sidewalks, to having the physical health to walk, and all the kinds of destinations you might want to go to, from work to the healthcare center, to your friends and family, to the library, to the grocery store, that it was going to be almost impossible to catalog or create a measurement that would catalog all of those things. No one would want to sit in a survey and answer 100 questions at a time. And so given this, as we were thinking about how to approach this work, we turned to the gold standard food security index as our model. And like transportation, there are a lot of different variables that go into food insecurity, right? Whether you can prepare food, the cost of food, the quality of food, the amount of food that you eat, the number of people in your household who are consuming food. And what makes the food security index so brilliant is that rather than trying to measure food insecurity by examining all these kinds of inputs that go into food, it measures food insecurity instead by asking people questions about the symptoms of food insecurity as people experience it qualitatively in their everyday lives. So it does so by asking questions like these two. In the last 12 months, did you ever eat less than you felt you should because there wasn't enough money for food? Or the food that we bought just didn't last and we didn't have enough to get more? Was that often, sometimes, or never true for your household? So to develop an analogous set of questions that would measure the symptoms of transportation insecurity, we started out by turning to our own qualitative data, which consisted of ethnographic observations and over 187 interviews, to identify the symptoms of transportation insecurity. And in doing so, we identified that these symptoms tended to manifest in three ways. So the first was material, and these are physically observable, and they relate to whether people can get around in a safe or timely manner, right? So this is things like people having very time-consuming travel, being stuck at home for long periods of time, being unsafe when they travel, rescheduling appointments. We also found that there were relational symptoms of transportation insecurity, and these related to social strains that stem from using social networks for travel, or from people's inability to see people because of transportation problems. So here you can think about, worrying about inconveniencing your friend's family for rides, or experiencing social isolation. And related, we identified a third manifestation, which was emotional. So this was stress and worry related to problems with transportation. So worrying about transportation, feeling left out. Sometimes people reported experiencing embarrassment because of their transportation problems. And so having identified these symptoms and the manifestations of transportation insecurity, what we next do is we drew on our qualitative research to brainstorm potential survey items that would tap into those experiences of insecurity. And so we came up with 23 items that capture the material, relational, and emotional manifestations. So for example, we had questions like, do you spend a lot of time waiting? Are you stuck at home? Do you worry about inconveniencing friends or family? And importantly, we intentionally left out out of all these questions, we left out outcomes of interest in terms of destinations where people would want to go to. So the doctor's office, employment, lots of people ask us, well, why don't you ask people if they got to work? And we did this so that you can use the index in a causal inference framework to look at the consequences of insecurity on those outcomes. So the next thing we did is we conducted 52 cognitive interviews in urban, suburban, and rural areas. And what cognitive interviews are designed to do is they're designed to make sure that when you develop survey questions, you're eliciting the kinds of responses that you want to, right? So oftentimes you look at survey questions, they're very simple. You want to make sure that people are understanding them and that when they respond, they're actually, understanding what you're asking and you're getting the data that you want. So what you do is you go out and you ask people to read your question. So we would say, please read the question out loud. And people would say, in the past 30 days, have you ever skipped going someplace because of a problem with transportation? And you ask people to respond to that. And as they're reading the question out loud and answering, you probe them, you ask them, okay, so you said you often skip trips. How often is that? What does that look like? What's the last trip that you skipped? Or when you think about skip trips, what kinds of trips what do you think about when you mean skip? And so you start to understand how they think about the question that you're posing to them and how they're answering it. And so once we completed these, we coded responses for question comprehension, recall, and judgment. And doing so, we found that some of our items just were burdensome and we got rid of them. We found that some items generated false positives, and so we dropped them as well. Each of our questions when we started this had, much like food security, each of our questions had a reference to the cost of transportation. So we would ask people, is this because you couldn't afford more transportation or different kinds of transportation? Thinking that if you were a really rich person, you could always afford, an Uber or something like this. And we learned through these interviews that that's just not the way people think about their transportation. They would say, it's not because I can't afford it, it's because the buses they're not reliable. And that's the problem that I face. So we dropped any reference to cost. And we also developed new sets of items. So one of the things that we learned through this process is for those who are really transportation insecure and experience this over time, they have what we call a changed universe. So they change what they think is possible for themselves. So if you ask people, did you skip a trip? They say no. And as you interview them about their transportation situations, you realize these people are skipping trips. It's not just that they're skipping trips, they're not going places, but they don't think about it like that because they've just, they've come to realize that they never can go places and just don't think about it at all. So from that, learning that, we developed a new set of questions to try to tap into those people. So with that information, we have our refined items. We identified a preliminary set of 16 index questions, and we put them on an original survey, and we conducted an exploratory factor analysis. And then we validated these 16 items on a nationally representative sample by fielding another original survey and conducting confirmatory factor analysis. And what we found in this validated measure was that each of our 16 items tapped into the symptoms of transportation insecurity. Each of them draw on a 30-day reference period, and each of the response options for all the items are never, sometimes, often. And so, for example, the 16 questions look a lot like this. Did you have to reschedule an appointment because of a problem with transportation? Were you late getting somewhere because of a problem with transportation? Did you feel stuck at home because of a problem with transportation? And when people take this survey, you can score the items, each question on a range of 0 equals never, 1 equals sometimes, and 2 equals often. And so people can get scores of insecurity that range from 0 to 32. So once we validated this index, one of the things we faced is we needed to be able to use it to identify people who are transportation insecure. And we also wanted to develop categories so we could be able to differentiate people of different levels of different degrees of insecurity. So to do this, we drew on survey data, and we used a mixed methods approach. And we identified 5 unique categories of transportation insecurity that can be determined by a respondent's sum score. And so these categories range from people who have no insecurity, right? They're able to get to the places that they need to go in a safer, timely manner, to people who have quite severe transportation insecurity, where your ability to get to the places you need to go is very severely limited. And what these categories allow us to do is not just identify who's transportation insecure and who's not, but really understand what transportation insecurity looks like by category. So if you recall a little bit ago, I told you that 1 in 4 Americans are transportation insecure. If you break this down by category, you find that 10% are marginally insecure, 6% are low insecure, 5% experience moderate insecurity, and 3% experience high insecurity. And you might remember that I said over half of people below the poverty line were transportation insecure. And so when you look at this by category, you get a much fuller picture of what this looks like, right? So this figure shows the prevalence of transportation insecurity in the US for 2018, and we break it down by poverty level. And as you can see, when we look at the data this way, we see that not only are those below 100% of the federal poverty level more likely to experience transportation insecurity, but they're also much more likely than those above 100% of the poverty level to experience the 2 most extreme categories or the 2 most severe categories of transportation insecurity. We can also see that those above 100% of the poverty line experience insecurity, but they're also much less likely to experience the most severe forms. And if categories help us get a fuller description of transportation insecurity, they can also help us to really understand the different kinds of relationships that transportation insecurity can have with outcomes of interest. So for an example, in a paper we published, we examined the association between transportation insecurity by category. and two separate outcomes. So we looked at people who reported having depressive symptoms and people self-rated physical health. And what these figures show is not only that there's an association between insecurity and these two outcomes, but that the associations are very different. So if you look at the relationship with depressive symptoms, we see a dose-response relationship where the association between insecurity and depressive symptoms becomes stronger as one's transportation insecurity becomes more extreme. In contrast, if you look on the right here, if you look at the relationship with physical health, we see a threshold relationship where once people report having any insecurity, and the association with transportation insecurity and physical health is relatively the same. That is, it doesn't get worse the more transportation insecure you are. Okay, so one challenge is that we developed and validated the 16-item index, but for anyone who uses survey research, anyone who has to pay for them, you know that this is very long, people's tolerance is low, and the more items you have, the more expensive your surveys are. So for the last few years, what we've been looking to do and what we've done is we've been developing a series of abbreviated scores. And you'll see that we've already validated a 6-item score, which has a subset of the questions of the 16 that you've seen. We are in the process of validating a 3-item abbreviated index that's much easier to use. There's some trade-offs, and I'm happy to talk about them of using each of these, but this at least allows people to use them in a way that's time and cost efficient. Okay, so that's a lot about the methods and research that went into this. I want to now sort of talk about how you can use it and how people have been using it to better understand and evaluate some of our mobility interventions. So one way that we've been working with people to do this is to understand the scope of the issue. You know, if you're trying to figure out how to address transportation insecurity, you're going to really want to understand the scope of the issue. We're trying to evaluate how effective our mobility initiatives are, and you want to calculate the ROI of our investments. We're going to need a baseline understanding of transportation insecurity nationally, at the state level, within regions, cities, and suburban and rural communities. And once you establish this baseline, by including the index on recurring surveys, we can really track how transportation insecurity is changing over time. We can compare rates with that of others, and we can assess our progress. So some examples here of ways that we've worked with stakeholders to do this kind of work is the TSI was used by the Minnesota Department of Transportation in their 2024 Omnibus survey to develop a baseline. It's been included in several regional surveys, including the Detroit Metropolitan Area Community Survey and the Baltimore Area Survey to document city-level prevalence. We've seen Snohomish County also they've been putting the TSI on their index to develop a baseline for the region. The state of Michigan has been a supporter of this work and plan to do the same. So you can use the index to just create a baseline and track it over time. A second way that the index can be used is that some of our initiatives really might aim to address transportation insecurity where it's most spatially concentrated, right? With the goal of helping communities where transportation insecurity is most severe. And so the TSI can be used to develop hotspots or identify hotspots where you might want to do some deployment, right? And no one to date has used the TSI in this way. And the biggest challenge here is really fielding a survey where you can have, where you get the fine enough spatial scales, but it can be done. I think this is a very promising sort of way if you're thinking about deployments. A third way that we've been working with people, the third way you might want to use it, is to determine whether your specific initiatives are achieving the goal of moving people from transportation insecurity to transportation security. So in this way, the TSI can be administered to participants in a pre and post testing phases of the initiative evaluation. So we've been working with a lot of stakeholders to do this kind of work. And just to give you a highlight of this, the U.S. Department of Transportation has a mobility, accessibility, and transportation insecurity demonstration project that's being run through the University of Minnesota. And so they'll be using the Transportation Security Index in the pre and post testing phases. Washington, D.C. has been using it to test their free public transit fare program. South Bend, Indiana has a Commuters Trust program. They've been using it in this evaluation way. Phoenix Mobility Rising has been evaluating their mobility wallet program. And then interestingly, we've seen the Urban Institute and Open Research, both of their respective studies of universal basic income has been using the TSI to ask the question of if you give people cash versus mobility initiatives, you know, if you just give them cash, will their transportation insecurity, will they move to transportation security? So another way, if you're thinking about evaluating, using the TSI for evaluation work, is that you can use it for those initiatives you may want to enroll participants who are transportation insecure, right? And so you can use really the TSI as a screener to see whether people are insecure, and then that would help you figure out if they qualify to be in your deployment or your initiative. And so, the experiments, the initiatives that I mentioned on the previous slide are using it in this way. But I also just wanted to call out that the TSI is being used in other ways for screeners. So we've gotten a lot of interest from people in the health programs who want to understand how transportation security is a social determinant of health. And the index has been encoded as a screener in the LOINC database, which is sort of the standard for identifying health measures, observations, and documents so data can be collected in a standardized way across the world in the healthcare system. Then finally, one of the ways you might want to use the index is to evaluate the causal impacts on outcomes of interest at the individual and community level, right? So if you're doing a deployment, you might want to, when you put the TSI on a survey, you want to have other outcomes of interest that you might be interested in, right? Whether people are getting, what their education levels are, their income, whether they're experiencing food insecurity, financial insecurity, right? So you can use the TSI to understand whether if you move people from insecurity to security, what is that impact having on their financial security, their educational outcomes, things like that. And then you can really think about how does that help other communities, right? You can use the TSI to scale up what the impacts are at the community level on these kinds of outcomes of interest. And so, the initiatives that I described in a couple of slides ago have been using it in this way, but we've also seen just a lot of researchers been interested in using the TSI in their own work on non-mobility initiatives to understand things like the link between transportation insecurity and colonoscopy completion or dialysis treatment outcomes. So I'll stop there and see if people have questions. I'm excited to hear if you think this would be useful to you, or we're excited to work with you on moments when you're ready to use this in your own kind of work. Thank you.
Thanks, Alex.
Where veterans are having issues getting to veteran services. And your use case number 2 is, I feel like the map is something I just saw recently with our team, where they're mapping things, especially in Baltimore. And I wondered maybe if you're doing anything with those kind of like cohorts or specific groups, and I think we should partner up and talk about how to use this index with what we're doing with them at some point.
I would love that. Yeah, we would love to do that. And one of the things, we've been sort of bouncing around as an idea for MCity is to really help with this kind of work and help with evaluation, identification of where there's problems, and help figure out, how do you design a project that really helps that group and evaluate whether it's working. So let's discuss more. Yeah.
Do you think it would be possible to build a model to kind of predict quantitatively what the mobility needs would be for different populations? To say, for instance, a single mother of 3 with a full-time job, by collecting data, could you build a model and say that individual probably needs, if they have a healthy mobility, environment, that individual should probably need to take, say, 100 trips a month between, work, childcare, doctor's appointments, and those sorts of things. Do you think it would be possible to build a model so you could, say for different types of groups, this would probably be a healthy level of mobility, and then be able to, compare actuals to something like that?
What I hear you asking is, could we create a threshold of, like, if we wanted universal basic mobility, what would that look like? What would be an adequate level of mobility, right? And then test against whether people are actually achieving it or below that line?
Yeah, and I imagine it'd be very different for different people at different stages of life and different locations. So it wouldn't be a single number, but taking into account the nature of their life or where they live. And you could probably, I imagine you would produce exactly the same sorts of results as people self-report their subjective experience, but I just wonder if it could be a way to build a model where you don't have to do all the surveys,
Yeah. Yeah, I think with enough data, this work is so preliminary in some ways that with enough data, enough, survey data that we can start to model sort of profiles of people who are likely to be transportation insecure, right? We can think about what their insecurity even might come from in different kinds of rural, urban, suburban contexts. And so I think we could definitely do that. Once we better understand what those profiles look like and what that level of mobility looks like. I've got a project now with someone through the CCAT where we're trying to create a measure of transportation insecurity just using mobile phone tracking data. And so to try to see, like, are there different ways that we can approximate this experience using other kinds of data? So certainly going in those directions. And if anyone has interest in partnering on doing that kind of stuff, we would love to expand this into that.
Thanks, Alex. Very interesting. I like to focus on symptoms, right? Identifying pain points in people's lives, and then sort of the engineering mind goes to, okay, how do we solve those pain points, right? And you had that slide on experiments that are being run. I wonder how many of the solutions are driven by information that comes from the survey versus how many are just pure hypotheses. Like, you've identified transportation security is insecure in this area, and then people come to you and say, I think they need more money for bus fare, and I think they need an autonomous shuttle, and I think that, right, like, people will pitch like solutions. Is there some way to tease out of the TSI data which solutions might be most likely to be good investments ahead of time? I know you can do it sort of like do the experiment and check, but can it be done ahead of time?
Not right now, but I think this is where we'd love to go, right? So one of the things that we're seeing is we're having conversations with people all over who are doing different initiatives, and they're all sort of struggling with what metrics to use to evaluate it. They're all everyone does something different. And what's happening is that people are doing really innovative work, but we don't understand we can't compare across these interventions because we don't have sort of a standard framework for evaluation. So one of the things we have been thinking about is, can MCity serve as sort of a center for that, collect the data, have a standard way of evaluating these projects, collect the data, warehouse the data so that researchers can use it to compare across different kinds of sites and interventions and say, in places of, certain kinds of density that have X features, X amount of public transit, X density, X sidewalk availability, here's what would work, right? Can we think about the conditions under which certain kind of interventions would work versus that's not going to work in this area, but here's what we're identifying as common sets of variables under which that works. So we would love to get there. And again, this is one of those things where we just need more data to ask those questions and start to see patterns across situations.
That sounds awesome. Thanks.
Frank, we have a question from Jeff in the.
Oh, let me read that.
That's Jeff with voice. Thank you, Alex. Were there people with disabilities in the study? Also curious if weather is a factor for transport security. For example, insecurity goes up in the winter in cold weather states.
Those are two great questions. So yes, we did have people who had limiting conditions in the survey, and I'm going to talk about this tomorrow, but you see that people who have disabilities are twice as likely as a general population to experience insecurity. So it's huge. And whereas 1 in 16 of people without disabilities experience that most extreme category of insecurity, 1 in 6 people with disabilities do. So this is a population that definitely experiences transportation insecurity disproportionately to people who don't have disabilities, and it's a huge area for intervention and sort of thinking through how to move them to security. Weather, so there's 2 ways to answer that. We have been validating the index at different weather points to make sure that we can, different seasonality to make sure that it's it can capture insecurity at different points. We haven't looked into differences across necessarily different weather, but we did have questions originally in our items that did allude to weather, that were like, one of them was, in the past 30 days, or I think it was 12 months, how often have you been exposed to harsh weather conditions, either by, extreme heat or cold and things like that. we found that those questions, they were symptoms of insecurity, but they were very burdensome and hard to get people to really understand them in a straightforward way. So that's definitely a symptom, but whether and how seasonality matters is, I think, another area ripe for more empirical research.